This is GIT3, the third presentation in GIT prepared by Prof.Mahmoud. Here we have the arterial phase in abdominal CT, showing abnormal vessels at the right lobe of the liver. This is the suggestion. It is something like an AV fistula, but it is post-biopsy fistula. Now here are the typical polycystic disease involving the liver, involving the pancreas, and involving part of the kidney. Multiple cysts of clear content involving the kidney, the pancreas, and the liver. Here is another example of adult polycystic disease of the kidneys with the liver and pancreas polycystic disease. Here you have the typical example of an abscess. An abscess is an area of liquefaction surrounded with edema around. This typical example of an abscess, but this type of an abscess is usually amoebic, so long it is a single and large, while the biogenic abscesses are usually small and multiple near each other, multiple foci of lucences near each other. This is a typical example of a large cyst with multiple septa and multiple ring shots inside. It is a hydatid disease. It's another example of a hydatid disease with separation of the germinal layer from the cutaneous layer from the host, separate, and thus a large irregular cyst is seen. It is similar to the water lily appearance of the hydatid disease of the lung, ruptured hydatid of the lung. Biliary cyst adenoma is similar to hydatid disease, but all are within the liver. This is number one, and number two, it presents bossy outline. If you compare this one with this one, this is the hydatid disease, or all are enclosed in one outline, smooth curved outline, while here it is of bossy outline. So biliary cyst adenoma is another possibility of septated liver cysts showing bossy outline. Here, this is the example for metastatic deposits, usually of adenocarcinoma, because the content is mucoid. And this is the macronodular surface of the liver in liver cirrhosis associated with large spleen. And somebody can ask me why it is enlarged. Why you can say that this is enlarged? Simply because it is cutting more than 3 rib distance. Usually the spleen is between the 9th and the 11th ribs, so it is enclosed between 3 rib distance, one space and one space, 3 ribs. But here it is, if you measure this or going with this, it is exceeding the 3 rib concept, so that means that it is much enlarged. And here are the cirrhotic nodules. And of course expect that you can find the varicose veins or the portosystemic collaterals. Now, what is this? This is something which could be a differential. Here we have the spleen between 3 ribs, and here we have something there. This appearance could be a subcapsular hematoma, could be subcapsular radiation infarction, and could be capsular deposits. So it is not only hematoma that can cause this appearance, but also radiation and metastatic deposits can produce such an appearance. This is a typical example of the hemangioma, starting here as low density area. Then in the arterial phase dynamic, we start to get the nodular enhancement, which becomes more and more and more, and then closing iris sign that the hemangioma is closed almost completely. This is typical for a hemangioma. While this one is typical for the carcinoma in the arterial phase. In the plain we find low density, and then in the early arterial starting to be similar to the liver, while in arterial phase proper we will find it enhancing. So this is early enhancement, still the artery, the aorta is there, and there is enhancement, and finally the liver is enhanced while the lesion washed out the contrast, and that's why it becomes low density within an enhancing liver tissue. This is the hepatocellular carcinoma. This is a contrast enhanced CT scan. You find that while in early arterial phase there is something enhancing and a ill-defined margin, typical of hepatocellular carcinoma. This is an examination for the biliary system, and here you can get the tube, and there you can find that there is stent here and another stent here there. So there is a PTC tube showing the biliary system. Never mind about these stents. Look at this. The biliary tracts are so thinned and as if splayed apart. This is appearance is called narrowed biliary radicals. Narrowed biliary radicals can be seen in 2 cases. First, on 3 cases actually. First, the cirrhotic liver. Second, metastatic liver. Third, the autoimmune liver and Budd-Chiari. Autoimmune and Budd-Chiari. So we have the biliary radicals narrowed, and this narrowing of the biliary radicals is seen in cirrhosis, in METs, metastatic deposits in the liver, and in autoimmune and Budd-Chiari syndrome. This is an example of dilated CBD or dilated CHD, if you want to put it correctly. The CBD is here, and this is the CHD, and this is a colloidal cyst, type 1 colloidal cyst. This disease is characterized by multiple segments of narrowing and multiple segments of dilatation alternating. It is an autoimmune disease, not an infection, but it is dangerous, and usually ends fatally, and this is called sclerosing cholangitis. If you look here, you will find that left side branches, this and that one are left side branches. This one is the right side branches. Maybe that one is closed or there is something there, but the common bile duct is not filled, and only part of it here is seen. That part is seen behind this branch or in front of this branch, this one. This is a part of the common bile duct. It is obstruction of the common hepatic duct at the confluence region, and this is the Klatskin tumor. Here the typical cholangiocarcinoma, when we have obstruction of the common bile duct, dilatation of the common bile duct, and shouldering and irregular narrowing of the distal segment, marked dilatation of intrahepatic biliary radicals. So if you want to report this, you will say that dilated intrahepatic biliary radicals, dilated common hepatic duct, dilated common bile duct, proximal segment, and dilated cystic duct, and the rest of the common bile duct is obstructed. Cholangiocarcinoma. Here there are multiple stones, the meniscus sign, where the contrast is delineating the stone. If you get the reverse is cholangiocarcinoma. But this here, the appearance of the contrast around the stone, appearance of contrast around the stone, this is typical for a stone, but this one can raise any possibility. But once you find the contrast is seeping around the stone, this is called meniscus sign or stone common bile duct. Now this is contrast within the duodenum, intestinal loops, jejunal loops, and duodenum, and this is contrast in the duodenum, which is enclosed by the head of the pancreas, and this is the appearance you can see in cases of annular pancreas, IVC, aorta, and head of pancreas, and this is the part of the duodenum within the head of the pancreas, annular pancreas. Here the pancreas itself is enlarged, definitely edematous, and air foci are seen, so it is also emphysematous. So this is edematous, necrotizing, emphysematous pancreatitis. Edematous, emphysematous, and necrotizing. Some parts are now lost, this area and that area. So it is edematous, emphysematous, and necrotizing pancreatitis with fluid formation at the paravertebral, as posteriorly, with fluid collecting posteriorly. Here we can get the pancreatic duct dilated, and this is common in chronic pancreatitis. This is an example of a pancreatic neoplasm, where we find this serous cystadenoma. Another example for a pancreatic neoplasm at the tail. And the third example is pancreatic tumor at the head. You can suspect that those involving the tail will present late, while those involving the head will present early because of the obstruction of the pancreatic and common bile duct at the papilla. This is an example of what we call cleft pancreas. This is an example of what we can say that this is post-traumatic splenic cyst. Post-traumatic splenic cyst. with calcification, but this appearance again could be due to aneurysm of the splenic artery. Microabscesses of the pancreas of the spleen can appear like this. Infiltrations due to lymphoma can appear the same. Lymphoma of the spleen, lymphoma of the retroperitoneal lymph nodes. And these are the infarcts of the spleen in cases of trauma, or in cases of portal vein thrombosis. We can find these infarcts. Thank you.